Have the editor-in-chief of the Lancet Medical Journal, Richard Horton, joining us here on Quick Take. Richard, as you saw the images and video of people getting vaccinated in the UK, tell us what's going through your head.
Oh, it's a very emotional moment. It's a turning point. We at last can see light at the end of this very dark tunnel that we've been in all year. And to be able to see the very first person outside of a clinical trial receive the Pfizer BioNTech vaccine, it's very, very exciting.
What does it mean for the numbers? Every day we get more and more concerning numbers about people who are in the hospital, people who are dying. Even though there is light at the end of the tunnel, when will we start to see the vaccine actually make a difference in the numbers that we're seeing in the US and around the world?
Well, you're absolutely right to ask that question, because we now need to manage expectations. The logistical challenge of producing, manufacturing, and distributing not just the BioNTech vaccine, but the other vaccines that we have coming through, and there are several now that will be ready for the beginning of the new year. It's a huge challenge. You know, the unit here is not the country. It's not the United Kingdom, and it's not the United States. If we're really going to protect ourselves from this pandemic, the unit is the world. We have to vaccinate the world if we're really going to be safe. So the poorest countries where it's most difficult to get the vaccine to, we have to be as concerned about them as we are about ourselves. And that's going to mean it's going to take most of 2021 in order to get the vaccine that far distributed. I would say that we're looking to protect ourselves going into the winter of 2021 and use most of next year to ramp up the vaccine program.
Richard, I'm wondering about the public relations campaign that needs to happen around the world. And I ask you because yesterday I was included in a tweet that got sent out about an interview that I did yesterday with a doctor from Johns Hopkins University talking about that vaccine. And for some reason, I just woke up this morning with dozens of replies from anti-vaxxers around the world who shared with me false information about the vaccines and what other doctors had said, that all of it not true. There seems to be a real public relations hurdle when it comes to actually convincing people that these vaccines are safe.
Yes, there is an anti-vaccination movement. The anti-vaccination community, the really anti-vaccination community, is actually quite small. They're very vociferous, they're very active on social media, but they're actually quite small. There is a much larger group of people most of the public, who are anxious, maybe a little uncertain, need to be assured about the safety as well as the effectiveness of the vaccine. And we're fighting for their hearts and minds. So we need our politicians as well as our scientists, some of our cultural figures who we respect and admire and trust. We need them to come forward and talk about the importance of vaccination. This needs to be a whole of society response. We can't rely on the science on its own. We now need to build a movement, a social movement for vaccination, because honestly, a vaccine is the only thing that's going to get us out of this situation.
Yeah, it is. And we don't actually need every person around the world to take the vaccine in order for us to get out of this. Explain why that is and why it's important still, though, that other people get vaccinated, because we do know, even with these clinical trials, not every single person, man, woman, and child, will be able to get vaccinated even in the coming years.
That's right. I mean, it's this old idea that came up at the beginning of the pandemic about herd immunity. And we need to reach a level of immunity in our communities that will then protect all of us. Every single person who gets vaccinated is making a positive contribution for the whole of society. And we estimate that we need to get about 2/3 of the population vaccinated in order to protect the whole of society, to give the virus very few places to go. So that's the goal. It's not 100%, it's about 2/3. And if we can get to 66, 67% of the population, then we should be in a very safe place.
Do we know anything yet about vaccinations in children? How young children are going to get the vaccine? How pregnant women are going to get the vaccine? Will they be able to actually get the vaccine, or have those clinical trials not been done?
It's a really important question, and the honest answer is that we're still in the realm of uncertainty. Just to be super cautious, Women who were pregnant were excluded from clinical trials. So we're trying to be very careful not to put anybody at risk when we're not absolutely certain the vaccine will be safely tolerated. In terms of children, I think young people, adolescents, young men and women will be perfectly safe. If we're talking about very young children, again, I think proceeding with caution is the right thing to do there. But as you rightly say, we don't need to vaccinate 100% of the population in order to protect the whole population. So we can take a careful approach and only vaccinate those we can be sure about.
How long until we know that the vaccine is really working?
Oh, well, I think once we start getting literally billions of doses into our communities so that we're up to the 30, 40, 50% of our population vaccinated, we're going to see the prevalence of the virus go down dramatically. And instead of what we call community transmission, where the virus is transmitted everywhere, it'll be just clusters of outbreaks in our population. I would estimate that we'll get to that point by the summer of 2021. And then over the summer, we'll continue to drive the prevalence of the virus down still further so that we can extinguish the pandemic going into the winter of next year. That's assuming that we can produce enough of the vaccine, that we can distribute it effectively. But you know, the other areas, we then have to watch our borders, because the main threat, once we get the number of infections down in our communities, well, the main threat is going to be the importation of new cases through our borders.
Editor-in-Chief of the Lancet Medical Journal, Richard Horton. Thank you for joining us again on Quick Take. We appreciate your time today.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.